Okay, this video is for case 4, and with this patient I would use, I would do electrical stimulation, so more specifically like a TENS unit with biphasic symmetrical parameters, I guess. And my reasoning for this is because, his main complaints are lack of range of motion and pain, but he's also having that like referred pain down into the shoulders and muscle guarding or muscle spasms. So there's parameters that basically tackle all of those with eStim, so I think that'd be a great thing to use to help with the pain and spasms and stuff. And I kind of did go back and forth for a little bit at least to see like, okay, do I want to set the parameters with like acute pain or like subacute since it's been like 2 weeks, but or do I just want to do like the muscle spasms? And my thought process is, the muscle spasms like are probably contributing a lot. Well, they are contributing a lot to like the lack of range of motion and pain too. So I think if we can like target those muscle spasms, we can also help with the pain and range of motion as well, especially like if we set it up for like an acute pain parameter or whatever. Yes, during treatment it could help reduce the pain and stuff, and we can work on range of motion during that, but like as far as pain goes, it's not going to have like lasting effects. So I think we'd get more bang for our buck out of doing like the muscle spasm reduction parameters. And to just like explain that to my patient, so like his x-rays and MRIs are clear, so like basically the cause of his pain is just that his muscles are protecting him so much, because his head, when he got in his accident, like he moved away, he didn't want to move, and it hurt him. And then so now his muscles are like, we're not gonna let you do that again to us. So they're firing, and when you have these muscles firing like constantly, like there's no time to relax, so it can cause a lot of pain and contribute to the lack of range of motion. So like all of those like range of motion, spasms, and pain, like they all kind of like play off each other. So I think I'd tell him that, okay, so with this unit, we're gonna send some impulses into those muscles that are like on the go, and like physiologically, like, calcium is like what makes them go. So hopefully this can, like, it will send impulses into him that will help get rid of that excess calcium that is like fire, and will help him relax. And then it will like facilitate better like muscle contractions that will help like cause his pain to go away and hopefully get some range of motion back. But if we target these spasms, like hopefully pain and range of motion will become better and easier for him to do and deal with. And so moving on to like how I would set this up with him, I would have him first make sure he removes any like metal or jewelry, like if he had a necklace on or something like that. And then also I'd have to get to the area, so like in this case, like the spine, the cervical spine, and like upper trap shoulder area. So I might have to have him like take his shirt off while I put these on, and so I would want to make sure he's okay with that and feels properly draped throughout the entire time. And then I would I would make sure that I clean the area with warm water and like a washcloth to make sure it's clean before I put any electrodes on. And then like when I do put electrodes on, I want to make sure that they are completely on, like evenly placed, and they're not over any like bony prominences, so like the spine of the scap or spinous processes, especially up in that area. And as far as patient positioning, it kind of depends on like what positions are provocative for him. Like I could have him sit, I guess, but he might not want to sit for like 30 minutes straight. But if we did sit, we could maybe look like more functionally every now and then to see if he's like able to get some more range of motion, because the spasms will maybe hopefully stop a little bit. But if he doesn't want to sit, I could maybe put him laying down like with the pillow, so it's more relaxing for him, as long as it's not messing up with the electrodes or like compressing them or causing any other pain or anything like that, I guess. With the electrodes, then I would have 4 of them, 2 sets of 2, and I'd have them crossed. And my reasoning for that is because you can have like higher amplitude in some spots to go deeper, and then lower amplitude in the other areas as well, and I can just get more current overall basically throughout the whole time with 4 versus 2 electrodes. And where I'd put them, I'd put 2 in like the cervical spine, maybe like more towards like cervical thoracic area, and then because he is having pain into his shoulders, but then I'll also definitely do like the upper traps too, because it's like those are your shoulders, and that area is like very important too. And then I want to make sure, like I said, not on a bony process, and I want to make sure they're evenly placed. And then as far as like the other parameters, I already said it'd be like biphasic symmetric waveform, and then I would have the frequency like 35 to 55 or to 50 pps. The pulse duration, I think I would have probably on the lower end of 200 microseconds, just because like 150 to 200 is like for smaller areas, and I think like the cervical spine into the upper trap is not a huge area, but I guess depending like yeah, I think I just keep it at 200 microseconds because it's not a huge area, but it's not teeny either. So yeah, and then with the amplitudes, you have to turn it up until there's a visible contraction, and you don't want it to be a painful contraction either, but just till there's a visible contraction. And then also you would want to ramp cycle, like, or the ramp up time, oh my gosh, at least 1 second. And then duty cycle, you want the duty cycle to be like equal, so 2 to 5 seconds on, 2 to 5 seconds off. We'll just call it 5, so 5 seconds on, 5 seconds off. And then the treatment time, 10 to 30 minutes. I might just do 30 just to see like if he reacts better with a longer time, and then adjust from there for next time. But basically during the whole thing, you want to make sure that there is a visible contraction happening, and you want to make sure that they're not having like any increased pain, or the contraction itself isn't causing pain, and make sure he doesn't do any motions that like cause an electrode to not be on there evenly. And then lastly, I probably assess like the pain level, or if there was any like increase in range of motion because the muscle guarding stopped a little bit. I want to assess that, and then next time I would make sure that we adjust the parameters based off of these results.